So first of all, the choice for choosing this topic, scope of pharmacy in Gulf countries. The main reason for choosing this topic is being a pharmacy person. Like we have chosen the pharmacy, somehow we are going to finish it, right? So after finishing the course, what are we going to do? So either it may be in India or outside India, whatever it may be. Like we should know what are all the opportunities available for our course, right? So inside India, like in India, what are the job opportunities available for pharmacy. But outside India, if you take UAE or other Western countries, we should be aware of the scope opportunities, like what are the job opportunities available for our course, so that after that we can just build our career there. It will be useful for us to build our career and grow ourselves there. So this is the basic thing we must know, like before we get out of our college. So that's the main reason I have chosen this topic. So here in this webinar, nothing is going to be technical, right? So I just don't want to waste your valuable time. I just want to share something which I have come across during my period of preparation for examinations or whatever it may be. I just want to share some things. So what are the happenings in UAE in the pharmacy, in the field of pharmacy, and what are the job opportunities available for the field of pharmacy, and what are all the things that we have to do, like what are all the things we have to do in our field to get a job, and also to improvise ourselves in the field of pharmacy. So Gulf is nothing but the composition of these nationalities are commonly known as Gulf, right? You can see the names of some countries here shown in the slide: Kuwait, Qatar, Saudi, UAE, Oman. So these are all the Muscat. So these are all the Muscat is nothing but the capital of Oman. So these are all the Gulf countries. So the most common thing among these Gulf countries are, there are two most common thing among these Gulf countries. One is the language. So Arabic is the official language of these countries. And the second most important thing is that petroleum. Petroleum and oil are the most important source of income for this Gulf country. So this is the basic introduction which we should be aware of about the Gulf country. So Dubai is not only a country. United Arab Emirates is a composition of 7 emirates. It contains, so these are all the emirates. You can see in the slide, I think: Abu Dhabi, Dubai, Ajman, Maldives, Fujairah, Ras Al Khaimah, and Sharjah. So these are the composition of the 7 emirates are known as United Arab Emirates. Here we commonly know about Dubai and also Abu Dhabi. Some about Sharjah also. So no, it is not that same. The composition of these 7 nationalities are known as UAE. In this, Abu Dhabi is the capital of UAE, and it plays the major role in the income of the UAE, like GDP. Dubai is well known for its well trade and also for its buildings. You have seen in the movies and everything, right? So Dubai is well known for its wealth. That's it. So here in this webinar, actually we are mainly focusing about this UAE. So I will let you know the reason why we are focusing mainly on the UAE. You can see there are various sectors in this. The major, the part will be healthcare sector. Second is marketing sector, industrial sector, and academic sector. Healthcare sector is nothing but the pharmacies, like whether it may be community pharmacy, retail pharmacy, clinical pharmacy, or hospital pharmacy. The second is the marketing sector, nothing but the sales representative. But here it is entirely different. We will know about that. Industrial sector is nothing but the pharmaceutical industries. Yes, here also in UAE we have pharmaceutical industries, which is available only in Ras Al Khaimah. We have seen 7 emirates, right? In that, Ras Al Khaimah contains 11 industrial industries actually, and also academic sector, which is nothing but the teaching profession. So we will discuss one by one about the various sectors and the scopes of job opportunity for each sector in the forthcoming slide. Healthcare sector. So as I mentioned earlier, retail pharmacy, clinical pharmacy, hospital pharmacy, and insurance sector. The insurance sector may be the new term for you people. So here, yeah, insurance plays a major role also. So retail sector, clinical, hospital, and insurance sector. These are all the sectors where we will be directly communicating with the patients. So these things directly falls under the healthcare sector, and healthcare sector plays a major role in the UAE. So diploma pharmacy and like a bachelor pharmacy, master pharmacy, and PharmD. So these are all the courses normally available. We know. So what are all the work nature for the different types of courses available? So diploma pharmacists, they are not allowed to work as a pharmacist in Dubai or UAE. So we must be
Yeah.
aware that diploma pharmacists are not pharmacists. They can
Okay.
practice only as a assistant pharmacist in Dubai. So what's an assistant pharmacist?
For
So
clinic.
he is no more allowed to dispense medication unless otherwise
Okay.
there is an availability of
Okay.
a B pharmacist, right? So diploma pharmacist can dispense medication only when there is an availability of a
20,000 square feet
B
with
farm candidate or a M farm
each floor
candidate.
7,000 square
So
feet.
B farm, like the bachelor pharmacy,
Yeah,
he is
each floor.
eligible to dispense medication. But what are all the rules and regulations, or
Seven
what
floors.
are all the like eligibility criteria, that we will discuss in the forthcoming slides.
Yeah, yeah. Because already the
M farm
ground first and the
pharmacy
second
practice.
we have a
Like
client
for example, you can take me
banks.
as an example. I have
So
done M
it
farm in
started third to
analysis,
ninth.
so I am not eligible to practice as a clinical pharmacist. I
Yeah.
think you must be you people must be
Eighth
aware
floor
of
is already
clinical pharmacist, right?
booked to
Clinical
client.
pharmacist different, and
Four, five,
like
six, seven.
outpatient pharmacist and
If
IP
you
pharmacist,
need
it's entirely
20,000 square
different.
feet, go for
So
four.
M Pharm, those who have done a Masters of Pharmacy in clinic,
Are you in
like
building?
pharmacy practice, can practice as a clinical pharmacist.
Okay.
Or
Once come to
he or
visit this
she
place,
should have done
I will show the
PharmD,
then
like
will be
they
told
can
you.
practice as a clinical pharmacist. This is the rule and amendment in
Okay.
UAE, not only in Dubai, all over United Arab Emirates. Yes. So what's the
Ground we have
eligibility?
an,
So
only
the previous
1,200
slide, I
square
have
feet.
said that there are some eligibility criteria for working as
Yeah,
a
yeah.
pharmacist in Dubai, right? So what's the eligibility criteria for becoming a pharmacist in
If
UAE? Not only
the
in
space
Dubai,
is
in
available, the
UAE.
provision is also
So the
available
first
to
thing is degree
take
from
the
a
lift.
certified university. Why it's certified university? Um, there are some
Structure,
universities
you can
and there are some colleges in
need to
India.
get a long size lift.
While doing background verification,
Passenger
Dubai
lift only is
government,
available.
they have blocked some
Uh,
eligibility letter from them,
okay,
from
sure.
the
Servicing
colleges.
area is
The reason is
available
they
on
are not
that side.
certified universities.
Uh,
So
okay,
we should
we'll
have
do one
completed
thing.
our degree
Can
or
you please visit the
master from a
client
certified university. The
building?
second thing is 2 years of experience in India.
Do one
So say
thing.
for
I will
example, you
reach
have
you
done
in
Bachelor of
visit this
Pharmacy
later.
in the year 2016, and the next 2 years, 2017 and
Yeah, in 10 to 15
2018,
minutes I will reach. I
you
will
must
drop it.
practice as a
I will
pharmacist
just
in
come to the
India.
within 10 minutes.
Either it may be in retail pharmacy or community pharmacy or in hospital pharmacy, that doesn't matter. But you have to practice as a pharmacist in India. So that's the mandatory thing to be followed. Then data flow
Okay,
verification.
okay.
This was the one I was speaking about. So what is data flow verification? This is nothing but the background verification.
Okay.
So so once you want to
The
get a
thing is
job in
only we
Dubai
have a
and
1,300 square
you
feet
are
of ground and
applying,
again we
like
start on third floor
I
also.
am so and so
So
person, I
that's
want to work as a pharmacist in Dubai or UAE, Sharjah or Milken, wherever it may be.
yeah.
What Dubai government will do, they will ask your
Okay.
certificates and also along with your 2 years experience certificate from India. That is the reason I told you the certificate should be valid from a certified university, and also the experience which you have gained in India should be a valid experience. See, Dubai government will cross verify everything, your certifications and also along with your experience certificate, right? So this is known as data flow verification. So data flow verification is nothing but the background verification. And finally, DHA eligibility certificate. This is nothing but the examination, pure examination, which is pure 100% technical examination, in which the questions will be based upon your, pharmacological action, pharmacokinetic, pharmacodynamics, and everything, and also some dose calculations also will be there. Chemistry will play a, like a little part there, but even though pharmacological, pharmacokinetic, pharmacodynamic, and also chemical, like dose calculations will play a major role in the examination. Examination. I have said examination. So what is the examination? What are all the exams available to practice as a pharmacist in UAE? Not only Dubai, I'm saying UAE, United Arab Emirates, including all the Emirates. So first one is the DHA, Dubai Health Authority. We have our Tamil Nadu Pharmacy Council, right? The same way, Dubai government have their own Dubai Health Authority, so which is responsible for the not only for the pharmacists, they are responsible for the health workers. Dubai Health Authority is an examination which is conducted by the Dubai Health Authority. So if you want to work as a pharmacist in Dubai, you have to pass the examination which is being conducted by DHA, so that you will be eligible. And DOH, the Department of Health, which is nothing but the Abu Dhabi. In the seven Emirates, Abu Dhabi has a different pattern of examination, has a different blueprint of examination, different syllabus for examination. That is known as DOH. Previously, it was known as HAAD, but the last year they have revised the syllabus, and now it is known as DOH, which is nothing but the Department of Health. So, if you people pass DOH examination, you can work as a pharmacist in Abu Dhabi, not in Dubai. Should be clear. If you pass DHA, you can work in Dubai. If you pass DOH, you can work only in Abu Dhabi, not in Dubai. The last one comes the MOH, Ministry of Health. The first two examinations we have seen the Dubai and the Abu Dhabi. The last examination comprises of all the remaining five Emirates. If you pass MAH, you can work in Sharjah, Ras Al Khaimah, like Queen, Fujairah, you can work, right? So the first two examinations will be absolutely very tough. DHA and DOH will be somewhat tough. MOH, it's manageable. So these are all the basic examinations available to work as a pharmacist in UAE, not in Dubai, UAE. And one more thing, now Dubai government and the government of UAE, they have implemented a new thing. What is that? If you pass DHA and you are working as a pharmacist, either it may be in retail pharmacy or clinical pharmacy or hospital pharmacy, you must have 6 months of experience in that field. Then you want to shift yourself to Dubai, like Abu Dhabi. What you can do, you can just apply to the government of Abu Dhabi, saying that I am so and so person. So I have worked in Dubai, passing this examination, but I just want to convert the examination. What Department of Health will do, they will convert the certificate to DOH. So now you are eligible to work in Abu Dhabi. So only with the conversion. So previously it was not like that. When I was preparing for the examination, if you write DHA, you have to work in Dubai. If you want to work in Abu Dhabi, again you have to write another one examination known as DOH. Now they have given some liberalization, so that it's actually very useful for us people, so that we can migrate to one emirate from other emirate. So the next slide. So now I think you are clear. So so these are all the eligibility. In the eligibility comes the examination. So you can do the data flow either before the eligibility, like before the examination, or after the examination. It's okay. You can write the examination, you can have the certificate in your hand, and then you can go for the data flow verification, or else you can do the data flow and then also you can go for the examination. That's okay. But the thing is, if you do the data flow, the examination, you should have cleared the examination within 1 year. So makes sense, right? The data flow is valid only for 1 year. So if you didn't pass the examination within 1 year, the data flow will be invalid. Then you have to go for one more time. So that's the main and most important thing to be discussed. So the cost of examination and also the cost of data flow. Indian money you will be spending around some 1 lakh rupees. So you have to finish the examination within 1 year. So again you have to, if it is not, then you have to spend one more time. So it's waste of money and also waste of energy. And one more thing regarding the examination, there are only 3 attempts for each examination. If you fail in DHA first attempt, next day, even the next day, you can go for the second attempt. If you fail again, you can go for the third attempt, even the next day. But if you fail in 3 attempts, then no more. After 2 years, you can apply for the examination. But within 2 years, if you apply anywhere within the Emirates, I'm not saying within Dubai, within the Emirates, the government will know that you have already failed in 3 times, and they will not allow you to apply for the examination unless you have finished the 2 years duration, right? So the maximum eligibility criteria is only 3 times within 2 years, right? As I said in the first slide, why we are focusing only on like only on UAE? Like we have Gulf countries, we have more Gulf countries. In those Gulf countries, we are focusing only in UAE. What is the reason? So what are the examinations available for other Gulf nations? Here you will come to know the reason for choosing UAE. So for Oman, you have to pass the Prometric examination conducted by the Oman government, right? But what is the issue there? You have to pass the examination, and also you have to pass the Viva, direct Viva. You have to go there. You have to pass a direct Viva so that you will be getting a license. So this is the trouble there in Oman. Second, Qatar. So Qatar, they have their own prometric examination for the same like Oman. But in Qatar, you know, they have a specific criteria which is very tough to get qualified to work as a pharmacist in Qatar, and also the scope is very narrow in Qatar. Kuwait also, they have their own prometric, which is the toughest among the examinations. Saudi, same Saudi clearance exam. They have some clearance exam. There also we have very narrow scope. But I have my own friends working there in Saudi, Oman, Qatar. Comparatively, UAE is the best place to choose, and also here we have broad scope. We have broad scope of opportunities to work as a pharmacist. Also, the examination point of view, we have very liberal examination here as compared to other Gulf countries. So in Oman, if you take 2013, I think so, Oman government has implemented a new system known as Omanization, which is nothing but the priority will be given to the Oman people. So remaining people will be kicked out. That's the basic thing. So same like Qatar, Kuwait, Saudi, they have their own rules and regulations. But Dubai, no, it doesn't have any rules and regulations like the same. If you are fit enough, if you are eligible, you are always allowed to work anywhere you want within the 7 MSs, right? So that's the reason most of the people they are choosing UAE to work. So we have discussed various sectors, right? Various type of pharmacy, retail pharmacy, clinical pharmacy, and hospital pharmacy, right? So the first one, the retail pharmacy, which is nothing but the, we have a small shop right near to our home in our native. The same way here also we can find large amount of retail pharmacy. This retail pharmacy, for example, you can take this retail pharmacy. It looks like a mall, right? Yes, actually, it is a mall. This is a pharmacy which is situated inside a well-known mall known as Dubai Mall. So can you just imagine this is a pharmacy? So this is how a real pharmacy I'm saying about the retail pharmacy in Dubai looks like. So here, there are no longer patients. Here there are customers. So here you will be getting the nutritional products, vitamins, supplements, and healthcare products. So these are the things which are mainly available here in this pharmacy. So this is the retail pharmacy, which is nothing but the smaller scale pharmacies. So the next one is the clinical pharmacy. So this is the best example. You can see it's a clinic actually, and nearby there's a pharmacy attached to it, right? So there is a difference between clinic and hospital. In hospital there we have inpatients. In clinic there are no inpatients. We have only outpatients coming, consulting a doctor, getting the medication from the pharmacy, going out. That's it. So there is no inpatient. There is no work for inpatient in clinic, and Dubai government does not allow patients to stay in clinic. Within 2 hours, they have to be admitted in a hospital if they are sick. So this is the clinic attached. And finally, hospital pharmacy. Nothing but you have seen the hospital pharmacies the say in India. The same here. We have hospital, we have pharmacies attached to it. The same type and same pattern. No other modification. Right. So in hospital, as I said, there are two type of pharmacies, right? One is a outpatient pharmacy, and other one is a inpatient pharmacy, right? There are two types of pharmacy. So in outpatient pharmacy, uh, here you can see the picture even. The pharmacist is dealing with the patient. He has no contact with the doctor. He is going to deal with the patient. Same like whatever we have done in India. We are getting a prescription. We are just giving the medication to the patient, right? The same way here is also the patient is being dealt by the pharmacist. But what is the difference between dealing the patient in India and Dubai in a OP pharmacy? This is the major difference. Medical insurance. In India, for example, hospital known as ABC. Your pharmacist is standing in a pharmacy, and the patient is coming to you and asking for a medication, showing the prescription. What the pharmacist will do? He will take the prescription, he will look into the prescription, and he will dispense the medication, collecting the cash. There may be some cashier, or either he has to do the both work. Here in Dubai, you must be aware that there is no like work for money here in Dubai. People will not pay for any medical expenses in Dubai. Everything will be under medical insurance. So that's the major difference, which is playing a major role in the Dubai healthcare system. No, entire thing is under medical insurance. Nothing is being paid. So the first and foremost important thing is mandatory medical insurance. What's mandatory medical insurance? Say, for example, me, Sankar. So Sankar is going to get work in Dubai. What's the basic thing Dubai government will do is he will ask Dubai government will ask the employer. Employer is nothing but the company which is providing a visa where I'm going to work. The company must like take a medical insurance under my name. So Sankar, if I, like from tomorrow, if I'm joining a company, from tomorrow onwards, I am eligible to get admitted or to get treatment under insurance, not under cash. So this is the mandatory rule which is being amended by the Dubai government. Not only Dubai government, all over UAE it is being amended. But Dubai government is very strict in this side. What are the benefits of medical insurance? So why patients should have medical insurance, and why Dubai government is very strict in this? Yes. So these are all the health benefits what a patient is going to get by having a medical health insurance. The first thing, as I mentioned, cash treatment. You are not going to pay anything. Entire thing will be paid by the insurance. You are not going to pay a single dirham from your pocket. Second thing, pre and post coverage, medical checkup, ambulance coverage, room rent, no nothing. Everything will be covered by the insurance. You will be paying nothing, right? Say for example, if I have flu or fever, and I'm going to visit a hospital. Consider I'm not working in a hospital, I'm working in a banking sector and I have flu. I'm going to visit a doctor and going to consult a doctor. I'm not going to pay anything in the hospital. Everything will be claimed under insurance, right? There may be some part, maybe some 10% or 20% of money will be paid from my pocket. So 10% in the sense, right? 100 dirhams of money. 100 dirhams means in Indian money it is around some 25,000 rupees. So, like, sorry, 2,500 rupees. The 2,500 rupees of the bill, you will be paying only 25 rupees. Just imagine. So, that's the basic thing. 1%, 2% even. Co-payment, we have 1%, 2%. Maximum percentage is 10 percentage. Right. So, this is the major part which we will be discussing. So, am I audible and is it visible? Hello? Is it audible, madam?
Sir?
Is it audible, madam? Am I audible?
Yes, sir. It's audible only, sir.
Thank you. Right. So this is the prescription which you people will see in Dubai. So why I'm showing this actually? You people are aware. You people must be aware of the things which is happening in UAE before you are deciding to get yourself into UAE. So these are the basic things which you must be aware of. Like in India, the prescription doesn't look like this, right? So here you can see this is the example of a prescription. Here I have hidden the sensitive information like patient details, visiting date, and mobile number. So actually, it is not allowed to show. So that's the reason I have just hidden this. So here you can see. So what are the things to be seen in a prescription? What are the things which will be available in a prescription in Dubai? So first is the ERX number. Then I will let you know. Diagnosis. Diagnosis in India, I'm sure that there will be no diagnosis details mentioned in a prescription. So when seeing a prescription, you will come to know what are all the ailments, what are all the health issues the patient is having, right? Third most thing is drug, dosage, frequency, practitioner, which doctor, whether it is a general practitioner, or orthopedician or oncologist or ENT or gastroenterologist or general surgeon, whatever it may be, it should be mentioned. I have hidden the information, but the doctor detail along with his same DH license number, everything will be visible in the prescription. It is mandatory. The pharmacist should go through the prescription. And also date and time when the patient came to the pharmacy, when the prescription has been generated, everything will be mentioned. Last one is the antibiotic. So uh, if you have any throat infection, or if you have any ailment in India, we will just go to the pharmacy. What the basic thing given to us is the erythromycin. That's I to remember. Erythromycin or azithromycin, 500. Take it daily, even for 3 days, or 250 2 times a day for 3 days. You will be okay, right? So this is not going to be in Dubai or UAE. If you are going to give any antibiotic without prescription, without being prescribed by doctor, you can just imagine the fine which a pharmacist will get is around 1 lakh Indian rupee. Without a prescription, if you are going to give an antibiotic, you will be getting a fine of 1 lakh Indian rupee. So in this way, yeah, Dubai government is far ahead actually. And also the first thing, ERX number. What is ERX number? So ERX number is nothing but the, you can see the number 6 or 7 digit number is available in the prescription, right? So if you just type the like this 7 digit number in a national platform, which is common all over Dubai, the entire information can be taken, which is actually very confidential, can be handled only by the pharmacist, no other person, not even the nurses can handle, only the pharmacist and doctor can handle. So only if this ERX number is available, the medications will be covered under insurance. This is what I was saying about. So these, for example, you can see these medications, right? You can just imagine the can you imagine the cost of this entire medication? It is around 3 lakh Indian rupees. So this patient is going to get the medication for 3 months, so which is costing around 3 lakh Indian rupee, 15 dirham. So this entire 3 lakh rupees is not going to pay even a single penny of money, even single dirhams of money. The patient is not going to pay from his pocket. Entire thing will be under insurance. This is the benefit of a health insurance in UAE. So what's the need of a diagnosis in a prescription? Why should there be a diagnosis mentioned in the prescription? You can see the patient is anemic, type 2 diabetes mellitus patient is having, and the patient is hyperlipidemia like cholesterol, hyperuricemia, non-alcoholic, and liver disease, and also chronic kidney disease. Why these should be mentioned? Yes, the pharmacist, we are the one who is actually dispensing the medication, so we should be aware why the patient is going to take these medications, why, and what are all the contraindications. That's a major thing. Say for example, in this prescription, the patient, you can see patient, there is no hypertension mentioned here, but say for example, if the patient is having hypertension, the diagnosis, hypertension is mentioned in the prescription. And also if the patient, if the doctor has mentioned phenylephrine or any class of antihistamine which is causing vasoconstriction, so you can just immediately call the doctor and you can say, doctor, patient is having high blood pressure, and also you have mentioned a drug which is going to cause harm to him, which is going to cause vasoconstriction. Yeah, that's the duty of a pharmacist in Dubai. So if you are given the medication without considering that and patient is ill, Dubai Health Authority is going to question you, not the doctor. So you are the governing authority for the medication. That's the reason diagnosis details are also given in the prescription. So just imagine how responsible we should be and how responsible we are in UAE and other countries, right? And also here, these are all the generic information, not the these are all the brand names, not the generic names. But now Dubai government is playing a major role. They are trying to implement that every prescription should be under the generic. Most probably, inshallah, maybe this year it will be implemented, I think. So so this is the basic prescription which is available in UAE. I just wanted to show you how a prescription looks in Dubai or in UAE. Okay. So how a pharmacist will dispense the medication? So as I said, ERS number. There is a separate platform like the same. I just don't want to confuse you people showing these things. So once you get into Dubai, you will come to know these things. But you will just type the ERX number here in the portal. The prescriptions will be downloaded and it will be immediately sent for the insurance authority. The turnover time for giving an approval for a medication in Dubai is 20 minutes. Within 20 minutes, whether it may be outpatient or inpatient, his entire health condition will be evaluated, examined, and it will be approved. Either it will be approved or denied. That is none of our business, but it will be evaluated within 20 minutes. So authorization from the insurance. So we pharmacists, we will send for approval from the insurance department. They will respond whether it is approved or denied. They will respond to us immediately within 20 minutes. The maximum time I'm saying is 20 minutes. Within 5 minutes, 2 minutes also they will respond. And also approval status. If you just get the form, I cannot actually attach those screenshot and everything. Those are all confidential, so I didn't attach those screenshots. If I would have attached, that would be very useful for the people, but those are all confidential. So approval status, we will just let the patient, we will let the patient know that it is approved or not approved, whatever it may be, and then it will be dispensed. If it is not approved, in that case, patient is willing to pay. In that case, we should pay. Unless otherwise, nothing is going to paid under cash here in Dubai. So supporting documents for non-coverage medication. Yes. So here we come back to the prescription. So in this, the first one, Mozambique. Most of the people in India, we are not aware of the Mozambique actually. It is not even listed in India. So this is the medication available only in Dubai. The cost of one single pen will be around some 10,000 rupees. So for these medications, what actually it is used for, high level of diabetes mellitus. When a patient is having very high level of diabetes mellitus, like the HbA1c level is more than 7, 7.5, even 6 to 7.5. In that case, we will be submitting the supporting documents like the patient sugar level and everything. So we have to send those things also to the insurance so that the insurance will provide the approval. Right. And also mail follow-up. Nothing but the mail. We have to send the insurance authority. We have to follow it up. That's the thing. So here you can see these things should be done by the pharmacist. Not only getting the prescription, dispensing the medication. We have to go through these things also. So in the sense, we should be aware. We should be aware of the medication. We should be aware of the dosages. We should be aware of the diagnosis condition, so that we can uh, take the approval. Take the approval for the medication, right? And control medication. So, what's a control medication? I think you people have a topic in jurisprudence, maybe. The same. We have scheduled drugs in India, right? The same way we have control medication. Also, you people will be aware that the government of UAE is very strict in controlling the narcotic substances. Here, nothing will be allowed. So, in this, there are four categories: full control, semi-control, narcotics, and banned drugs. You people should have a basic knowledge about these things. Which are the medications available in Dubai? Which are the things that we can even take it? If you are coming to Dubai for a visit, what are the things? What are the medications even you can bring into Dubai, right? So full control medication is nothing but the, for example, alprazolam. We have, right, in India we have alprazolam that falls under full control medication. The medication which is going to cause sedation and addictions. It is known as full control. Semi-control is nothing but, in India we have a pregabalin, right? Pregabalin is normally given in the pharmacy. Amitriptyline is normally given for headache and neuropathic pain in India. But here that is listed under semi-control medication. We cannot get the medication easily unless it is being prescribed, and there are large number of pharmacies that you will see in the next slide. Narcotics, you people will be aware: morphine, pethidine, fentanyl. Those are all the opioid analgesics. Those are all the narcotics. Banned drugs. So banned drugs, for example, general medication. Yes. So here, even though if we have any some countries they have cocaine as a listed medication. If you are bringing cocaine into Dubai or for medicinal purposes, no, you are not allowed to bring it, and there is no place for cocaine in Dubai. Where the control medication, this is how a control medication and the semi-control medication will be dispensed in Dubai. So what is NPCM, National Portal for Control Medication? This is a like a unique platform which the Dubai government DHA controls. So why? What's the use of this NPCM? So here you can see an identity card, right? So this is the identity card which is similar to our Aadhaar card. We have Aadhaar card in India.
now
No?
our team
The
from
same way
Chennai.
we have identity card in India, which is known as Emirates ID. So even I have the Emirates ID. Those who are going to work, who are a residential in Dubai, they must have a Emirates ID. It is actually similar to our passport. We can use the Emirates ID as our passport even. If you want to go out of Dubai, you can just use your Emirates ID.
P1
If
number.
you want to get your details, if you want to get your whatever details it may be, here you can see a chip, right? Everything will be stored in that chip. So here the medication details will also be stored. So what the pharmacist will do once the patient comes to you and he is having some control medication, semi-control medication in the prescription, what he will do is he will just get a Emirates ID. The Emirates ID will be directly linked with the DHA portal. So there we have to monitor what are all the details mentioned, why the patient is consuming the narcotic drug. So what are all the dosages given. So the dosages will be adjusted only based upon the practitioner, type of practitioner. So general physician can handle this much medication, orthopedician can dispense this much medication. Like there are some criteria which is being framed by the Dubai Health Authority. So it is also a duty of a pharmacist. So the pharmacist is the person who is entirely responsible for dispensing the control medication, and this is the highest risk thing ever in Dubai. So even one capsule of control medication is, if it is missing in a hospital, it is going to cause a huge effect actually. So in India, we have drug inspectors, right? Those who are, the drug inspectors will be visiting our hospital. We will be visiting our license, our refrigerator temperature, everything. So here, the same way, Dubai Health Authority, they have inspectors. So they will also visit us regularly. Here, the first and predominant thing they will look for is the control medication. Say, for example, a hospital contains 100 type of control medication. In that, if one capsule is missing, even that is also going to play a major role. And within a minute, they can say who has dispensed the control medication. So, see how responsible we should be in a field of pharmacy in Dubai or in UAE. And so, these in the previous slides, we have discussed about the outpatient pharmacist. In this slide, we'll be discussing about the clinical pharmacist. As I have already mentioned, clinical pharmacist. In this photo, you can see that clinical pharmacist is dealing with the doctor, not with the patient. In OP, outpatient pharmacy, we have seen that pharmacist was dealing with the patient, not with the doctor, right? Here, he will be directly dealing with the doctor, not with the patient. So, clinical pharmacist, I think you people will be aware what is the duty of a clinical pharmacist and what are all the duties assigned to him. He is not going to dispense any medication standing in the OP pharmacy. He has different duties assigned to him. He will be in the inpatient pharmacy. He will be dispensing medication only to the inpatient pharmacist. So, what is the criteria for becoming an inpatient pharmacist or clinical pharmacist? Form D. Either Form D or it should be pharmacy practice with clinical pharmacist examination. So, we have discussed various type of examination, right? DOH, DHA, MOH, and the HAAD or DOH. The same way, there is a different pattern of examination also for the clinical pharmacist. So, if you pass the clinical pharmacist examination, you can practice as a clinical pharmacist. But if you are passing DH examination and if you are trying to get a job as a clinical pharmacist, no, you cannot. You are not allowed to practice. There is a separate examination, but the data for verification, certification, verification, everything is same. Only the exam pattern is different. So here comes the role of a clinical pharmacist. Previous slides we have seen the role of a OP pharmacist, right? What are all the duties of a OP pharmacist? He will get the medication approved under insurance. He will give the narcotic control medication, and what are all the diagnostic information we should be governing. Everything we have seen here. Clinical pharmacist or inpatient pharmacist. What are the duties of an inpatient pharmacist? So identification of drug interaction. This is the most and the predominant duty of a clinical pharmacist. So you should be aware of. I think you would be aware of what is drug interaction. Like so the activity or efficacy of a single drug will be affected by the other drug, right? So that's known as drug drug interaction, or one more interaction is also there, drug food interaction also there, right? So the effect of a drug will be, efficacy of a drug will be affected by the food we are taking. So these are the things which will be monitored by the clinical pharmacist. You should have one thing in mind: pharmacology is a predominant topic for us people to study. So we should be, the clinical pharmacist should be advising the doctor, so and so drugs are like not interactable, doctor. So and so drug and food are not, like we cannot give along with each other. So we should be strong enough. We should have strong knowledge about the interaction, right? So if you are a clinical pharmacist, and identification of the side effects. So what are the side effects? See, each and every drug will have a side effect. Say, simple example, paracetamol. If you take paracetamol, you are going to have gastritis, right? So if you are going to take aspirin, acetyl salicylic acid, you are going to have gastritis. The same way, each and every drug will have the side effect, and we should be aware of what are all the side effects of the each and every drug. Nitrofurantoin, there is a antibiotic which is commonly given for urinary tract infection. If a patient is having nitrofurantoin, there will be a like slight change in the urination color, and it's actually a fluorescent color, or it will be a reddish color. So, but the patient will be afraid, and they will be asking you why there is a change in the color, like am I bleeding, like that. So, but you should be aware what is the side effect. Drug selection, we have to inform doctor what is the drug actually which is suitable for the person. If a person is like having pneumonia, if a person is having chest pain, chest congestion, and having, if patient is having pneumonia, what are the antibiotics we can give? Doctors, you believe me, doctors will call you pharmacist and ask for the drug which is to be prescribed. Can you imagine? Here doctors will ask you people what is the drug which will be optimum for this patient. Patient is having this condition. What are all the antibiotics we have in our pharmacy, and which is suitable for the patient? These are all the query which will be asked by a doctor to a clinical pharmacist, right? So medication review, that is nothing but the what are the medication given to a patient by a pharmacy, by a doctor, and what are the current medication he is taking, everything while he is being admitted in hospital, and information about the cost and effectiveness. That is certainly different. It doesn't fall for hospital category. And patient counseling, there also it's a major thing. How a patient should take a medication. So the best example is azithromycin. So azithromycin is an antibiotic which people will be in India. Normally we are taking it after food, 1 hour, like immediately after. But it should be 1 hour or 2 hour after food, or half an hour before food. So these are all the information we should provide to a patient. How a drug should be taken. For example, tamsulosin. If you are taking tamsulosin in the morning, there is no use. Tamsulosin is a drug which is normally given for a patient having calcus, urinary calcus. It should be given at the night time, and also you have to inform patient don't have don't drink too much water. So these are all the like patient counseling things which yeah, doctor of pharmacy, like a clinical pharmacist, should be aware of, and also provide information about the medication efficacy. So here, one more thing. Here in UAE, each and every medication which you are giving to a patient, they will ask you why for I am taking this medication. Even single paracetamol. Yesterday night, even I have a incident. A patient was asking me why should I have a paracetamol? I don't have any headache. I don't have any fever. Why did doctor prescribe a paracetamol, and why should I take a medication? So you pharmacist, just imagine the situation. You pharmacist should be ready to answer the question to the patient. So that much aware you should be. So we have come across the major sector, which is nothing but the clinical sector and healthcare sector, which is available in UAE. And this sector actually plays a major role in terms of GDP in UAE GDP, and also in terms of scope of pharmacy. We people have broad scope in terms of healthcare condition, which we have discussed. So I said that I will not go that much into the technical part, and I know that I have entered into a technical part, but sorry for that. So the next one will be marketing sector, which is nothing but the sales representative. But in India, sales representatives are those people who are just having a motorbike, and going to visit a doctor, and you know, speaking with them for convincing them to write their products, right? So it is entirely different in Dubai. In Dubai, marketing sector is entirely different. And can you just imagine? So we have I said we have so many sectors, right? So in those sectors, marketing sector, a person who is working in marketing sector will be the most paid person. We cannot even imagine his monthly salary. So, but there are some difficulties in this sector. What are the difficulties? First one is the driving license. Here, there is no bike actually. Here, everything will be under car. There is no bike. You cannot see any bike unless otherwise it is a Talabat driver. So, no one will be riding a bike here in UAE. Everything will be car. So, here a sales representative will own a car. That's the basic mandatory criteria for becoming a sales representative in Dubai or in UAE. So driving license, I think you people will be aware that driving license of Dubai or UAE is the toughest driving license. It's one among the toughest driving license in the world. So if you're getting a driving license in Dubai, it's like getting some award or getting some gold medal in our university examination. So it's very tough. It's very tough, and also the amount which we'll be paying for getting the driving license is huge. And representative or marketing representative in Dubai. And also the major thing is communication. You should be bold enough to speak with the doctor. Here you are not going to deal only with the Indian doctors. Here we have multinational doctors whom you will be dealing with. So you should be well aware of the like language which doctor is going to speak with you. So how much languages you are learning, that is going to play a major role in the marketing sector. So these are all the difficulties, but I already mentioned marketing sector people, they are earning the more actually. Like actually, frankly speaking, we people are jealous about those people. So our 3 month salary maybe their 1 month salary. So this is the example of a marketing sector in Dubai. But in marketing sector also there are two types of marketing. One is technical marketing. Those marketing pharmacists will be directly going to the doctor and they will be speaking about the drugs which they have, which their company have, and also what are the certifications, in which way their brand is going to like compete with the other brand. And the second thing is the sales representative, which is nothing but the person who is going to take order from a manufacturing company or going to take order from a hospital. So actually, here the pharmacist will mainly look for the technical sales representative job. The second, the normal sales representative job will be mostly chosen by the marketing people, MBA sector people. So it's actually a very good sector. But as I said, these two are the most toughest: driving license and own vehicle. And one more thing is the cost of getting a driving license in UAE is more than owning a individual car. Yeah, the cost of a car will be around some maybe some 2 lakh dirhams. If you just imagine the car, sorry, around some like 15,000 dirhams. The cost of getting a driving license will be 20,000 dirhams. So that's the issue. So third sector, pharma industry. As I mentioned, yes, here we do have pharma industries in UAE. Most of the people we don't know that. Even me, when I was new to Dubai, I was wondering whether we have pharma industries in Dubai. Yes, we do. In UAE, we have more than 11 plants in UAE. Sorry, yeah, UAE. So, if you are looking for a job in pharma industry, what are the qualifications? The first one is the bachelor degree. If you are pharmacy bachelor, so you will be getting a job as a like in QC and in production department. You know, quality chemist, right? Quality chemist, and also in the production department. Same like India. India also the same way. If you are having bachelor degree, you will be getting a job as a QC and also in the production department. If you are having a master's in analysis, you're getting a job in analytical research and development. If you're having masters in physics, you are having scope in the formulation research and development, which is nothing but the related to the formulations and what are the seeds and everything they are using for the formulation. So here, as I already mentioned, we have 10 GMP plant and one US FDA plant. So GMP and US you must be aware what is GMP and US FDA. GMP is nothing but the good manufacturing practice plan. So it's a liberal plan, we can say. US FDA is nothing but the SOP which is being framed by the United States. Like it's somewhat tough actually. The SOP framed by the US FDA is more tough, and the standard operating procedure will be more tough. So here we have one US FDA in UAE. And the final and most important thing, like personally, I wanted to discuss with you people is the chemical allergy. See, I am the best example for you. See, I have done my master's in analysis, and I always wanted to be in industrial sector. So after finishing my master's, I got a job as a research analytical research scientist (R&D), and I was working as a research scientist one in a well-known industry in Tamil Nadu. But after 1 year, I came to know that I was allergic to one of the chemical which is available in the laboratory. So yeah, I have done some skin test and everything, and finally we concluded that I was allergic to acetone. So what is acetone? Acetone is the basic mobile phase which is used for a HPLC. So just imagine a pharmacist working as a industrial pharmacist, which who is allergic to acetone. So without touching acetone, you are not going to enter into the pharma industry. So 90 percentage of the mobile phases which we are using in industry is acetone. So then I'm not fit to enter into the clinical into the industrial sector anymore. So I'm the best example for you people. So then I decided to shift my career into the hospital sector. So I was completely allergic to the chemical agent. So I was not aware when I was doing my UG and PG. I was not aware that I was allergic to the chemical reagents. So this is actually the best example for people. So once, like, if you wanted to pursue your career into industrial sector, just be aware that you are not allergic to any chemical allergen. So say in my case, I have wasted 1 year of my experience in a industry. So see, somehow I have experience in handling HPLC, UPLC. That's different. But even though that 1 year of experience, there is no use with that, right? Then I have to shift entirely to the clinical sector. So just imagine. So this is my personal suggestion, you people. So either if you want to pursue yourself into the clinical sector or industrial sector, be aware that you are not allergic to any type of chemical reagent, right? So this plays a major role. Luckily, when I was in India, I came to know that I'm allergic. Just imagine that after coming to Dubai, I got a job in Dubai industry, and I was allergic to chemical. Then just imagine my situation. So, so these are the basic things, but that will ruin our life even. That will ruin our career even. So you people should be aware. You are just studying, right? You are just in the this learning phase. So just you should be aware whether you are allergic to any chemical reaction. So academic sector, as I have made the slide, we have very narrow scope in academic sector. The same like this slide, it's very narrow, and also it's very small. The scope is very small in UAE. Yes, what is the mandatory thing to academic sector is nothing but the teaching field. uh, the mandatory thing is we should have a doctorate, and also we should have 5 years of teaching experience in India. So that's the mandatory thing. But yeah, here the scope is very very narrow unless you have a strong recommendation in the college. But the colleges are actually very standard here. And but the narrow is very very scope. Sorry, the scope is very very narrow. So here we have discussed these many things, right? So what are all the challenges and what are all the things we should be like fit enough to become a pharmacist or to build our career in UAE? The first one is the communication. As I have already mentioned, communication plays a major role. It will start playing like from your interview itself. The interviewer will mainly look for your communication skills. He is not going to like look into your technical skills even. He is mainly focusing on your communication skills, knowledge about the medication. This is nothing but the rocket science. It's not about the rocket science or about the newer drug molecule or a novel drug molecule or a lead what nothing. This is the basic knowledge about the medication. What is acetaminophen? So the paracetamol is acetaminophen, right? So these are all the basic things we should be aware of. And flexibility to work with a multinational co-worker. That's the main thing we should be knowing about. Here in UAE, we have n number of co-workers working with you. So just in my case, I'm a pharmacist now in a hospital, right? So I have 20 workers with me. Just imagine only two of us are Indians. Remaining 18 are from other nationalities. So we should be like flexible to work with them. So our nature will be entirely different from their nature. So we should be able to uh, like work with them. We should be able to fluctuate with them. So that's the main thing which plays a major role here to build your career. And the last two things are consultancy and direct recruitment. So this is the consultancy. So there are some consultancies in India which will get a job in Dubai. They will say that I will get a job in Dubai and you have to pay this much amount to them, like that. So if you're asking me personally, what I will say is, yeah, it's okay to get a job using a consultancy, but you should be aware that they are repeated, they are trustworthy before spending money to them. You're going to spend lakhs, you're going to give lakhs to them before even getting a job. So you should be aware that they are reputed agencies, right? And direct recruitment, this is the best thing actually to be direct recruitment. How direct recruitment is taking place, even we are not aware where the interview is going on, right? So most of the people, we are not aware that the recruiting agency, that even the pharmacy people are directly HR from the Dubai pharmacy. They are coming directly to India. They are recruiting people from India. So I came in the same way. So the people from Dubai, they came to India. They recruited us. So they actually managed our visa. They managed our travel expenses, everything. So nothing is actually through the consultancy. So I prefer that way. So it's actually the safest way ever. Actually, the time period for the recruitment will be between December to April. So during this period, once you get out of the course, you will you can just attend the interviews during this period, December to April. Within this period, the consultant is the HR department from the Dubai pharmacy. They will come to India and they will hire you directly, not using the using any other consultancy or anything. So please make use of that. So at the end, so we have discussed these many struggles. So the Dubai government is very strict, the Dubai health authority is very strict, and here we are having so much stress, so much burdens, and we should be very aware, you know. But why? Why are we choosing Dubai? First and foremost thing is the improved life standard. So your life standard will be automatically improved once you get a job. Once you start practicing in Dubai as a pharmacist, your life standard will be automatically improved. Second thing is financial growth, right? So we people are we are studying pharmacy and we are spending lakhs to finish the course. Why? So the ultimate goal is to earn, right? So absolutely, financial growth in India is far high compared to India or any other country, I would say. Financial growth is the major thing. Career growth, yes, you can improve in your career. So you can start as a retail pharmacist, then you can enter into clinical pharmacy, then you can go into hospital pharmacy. Getting a job in hospital pharmacy in Dubai, being an Indian, it's not a good it's not an easy job here actually. So like the same way we can improve ourselves in the field of pharmacy. Easy to travel. This is actually the thing which I have. The reason I have chosen Dubai, can you imagine the travel time between India and Dubai? It's around some 3 hours. Within 3 hours we can just travel from UAE to India. So this is the time which you people will take to reach from your college to Sankarasubramian during heavy traffic, right? 3 hours it will take. So last year I came to Coimbatore. It took around 2 hours for me to reach Sankarasubramian to your college, nearby your college, somewhere there. So yeah, that's the main reason for me. See, money is not only the ultimate goal, right? We have to be accessible to reach India. So that's also the main thing. people are choosing
See,
Dubai.
see, artificial
No bond. So that's
எம்எல்ஏ
also,
அச்சீவ்
you know,
ஆயிடுச்சுங்க.
here no one is going to compel you. You should work 3 years. You should work 4 years. No, no one is going to compel
பிடெக்ல
you. Yes,
வந்து
there are some bonds.
artificial
There are the
intelligence
basic bonds. You know, mutual bond. It is known as
அப்ரூவல் இருக்குல்ல
2 years of mutual bond. The employer,
அதுவும் தானே
like
சார்
employer, the company will ask a bond from you. You will also sign.
பில்டிங்
But if you
அப்ரூவல்
want
அப்படி
to break
இருக்கு.
the bond, no one is going to harm you. No one is going to
சரி சார்.
like force you. You must stay. No, if you want to break the bond, yes, you are always welcome to break the bond, but the thing is you should pay some money, maybe 1 month salary, or you will be working 3 months in the same company as a notice period. That's it. There is no other bond other than that. That's the reason Dubai is the safest country for the employer. Dubai, all over UAE. Employment law, here the department of employment is very, very, very strict. Actually, if you are facing any issue with your employer, you can directly raise a complaint to the employment. Immediate action will be taken. Immediate action in the sense, within 1 hour the employment department will directly visit the company. Experience is valid. Yes, being a pharmacist, if you are having an experience of 5 years in USA, sorry, UAE, and you are going, if you are willing to go to
சரி நான் மாற்றிக்கிறேன்.
Australia or any other Western countries, yes, the experience
சரி
is
நான் மாற்றிக்கிறேன்.
most valid compared to the experience in India. So that's also a major thing. And the final thing is no tax. Can you imagine? For example, if you are getting 1 lakh or 1.5 lakhs salary in Dubai, the whole 1.5 lakhs will be sent to your home. Like you can manage your expenses here, and the rest of the money, like for example 1 lakh, you will be sending it back to your home. Dubai government is not going to get a single dirham from your pocket as a tax. So that it makes sense, right? So no other country in the world is doing the same. You know, Australia, everywhere, other Western countries, they have some taxes. You have to pay some tax. The same way we have income tax in India, right? We have the same way they have their own taxes. Most of my friends there in Australia and Western countries, they are paying more amount from their income as a tax. So comparatively, yeah, I'm not paying any tax to the Dubai government. Whatever I'm earning, I'm having as a saving, or else I can send it to my home. That's the best. Not only for me, this is common for the residents in Dubai. So there is no tax. So these are all the reason why people are choosing Dubai, why people are choosing UAE. So these are so we have a lot of struggles to enter here. We have a lot of struggles to practice as a pharmacist here. But even though these are all the best things to choose Dubai or UAE, right? So thank you so much actually for the excellent opportunity, and I hope that I didn't waste your 1 hour of golden
சரி.
period. And so the final thing is, I just wanted to convey that we people are responsible. You know, pharmacist as a pharmacist, we people should be responsible. There is no trial and error in our field. Like if some medication or something is given wrong to a patient, there is no other go. If, for example,
சரி,
uh, just imagine IT sector people, they are doing some
சரி.
software things, and they're getting some software things. If something goes wrong, they will just throw it away and they will do a new thing. But in our field, nothing. Especially in outpatient department, if you are giving a medication to a patient, immediately they will take it without even knowing what the medication is. So that much belief patients or public is having on us. So be a responsible pharmacist, whether it may be a diploma or bachelor or doctorate, whatever it may be, or
ஃப்ரிட்ஜை
you
வேணா
know,
இங்கே தூக்கிட்டு வரேன் கைக்கு.
masters. Be a responsible pharmacist, and we have a lot of scope all over the world, and improve yourself and be knowledgeable. Thank you.